So yeah, I wanted to talk about agent-based modeling and look at a broad array of applications from playground to planet. But I wanted to start with a quick survey. How many people in the room are modelers? Raise your hand if you're a modeler. Okay, a couple. So I think that's actually the wrong answer. I think everyone is a modeler. And when you close your eyes and imagine an epidemic or a spread of democracy or a migration or economic future, you're running a model. You're running some model. It's just an implicit mental model that you haven't written down. So we're all modeling one way or the other. The only real choice is not whether to model, but whether to do it explicitly or implicitly. And explicit models have some advantages over implicit models. For example, they force you to clarify your assumptions to yourself first and foremost. I mean, what am I actually assuming? They let you do sensitivity analysis, which is the way of coping with uncertainty. We don't know a lot of things. Sometimes we don't know. Excuse me. And we can run the model under many different assumptions and see how much the uncertainties matter, or what are the primary uncertainties in the first place. We can let other people replicate the model. You can't replicate my mental model. You can replicate my explicit model. And I can test the explicit models against actual data. And in fact, they even guide data collection. I mean, sometimes you build the model first and it tells you, wow, I really need to get that data. And there are lots of aims for modeling at many scales. We build toy models at my lab that are just meant to suggest novel avenues, and very high fidelity global models, and I'll show you examples of both. All right, so we're all modeling anyway. Let's try to do it explicitly. Okay, so you're saying, okay, I get that, but modeling, don't I have to know a ton of math to do that? And no, you really don't. Agent-based modeling is nice in this respect. You don't have to know a lot of math to do it. And let me try to convince you of that with a really simple epidemic model. We'll generalize all of this to global pandemic models, all sorts of fancy stuff. But you can get a lot of insight out of purely toy, playground level models. So here's an agent-based model of an epidemic on a playground. Blue kids are healthy, red kids are sick. Kids are just going to run around the playground. If a red bumps into a blue, he sneezes on them, and the blue gets sick with some probability. And then having had the bug for a while, all sick kids die. Morbid, but that's the way I like it. So that's how it's going to be. Okay? And we start with one kid. And there's no real equations, right? It's just simple little rules. And what happens? Here's our red index case. And they're moving around the playground. When a red bumps into a blue, he gives them a bug with some probability. And when you're sick, you die with some probability per day. And in our course on agent-based modeling, you would learn how to build this model that you're looking at probably in a couple weeks. Agreed? I have students here. Okay. Very, very low barrier to entry to do modeling this way. Okay, so trust me, everybody gets it, and they all die. And that's just the way it is. Okay? So here's another, but what happened? Oh, so everybody gets it and they all die. All right? So how about this? One kid got it, they all died. What if I make the bug twice as lethal? That is, I make it twice as likely that you die every day, right? Increase the death probability by 2. I double that. So it's much worse for the individual, right? If you get it, you're twice as likely to die. Is it worse for society? I mean, you'd think so. You'd say, well, it's worse for the person. It must be worse for the group. Is that right? No, it isn't. It's not right. Because the kids who get it die too fast to transmit it. So they don't all die. There's kids left at the end. Now, I'm not recommending that we make bugs more lethal. I'm just saying that it's an insight about, and in fact, some bugs like Ebola are very lethal and they're hard to spread precisely for that reason. How about this? Herd immunity. Let's go back to the first run. 100 kids got sick. Everybody got it. They all died. Imagine a perfect vaccine, and I give 60 kids the perfect vaccine and color them yellow. So 60 kids have the perfect vaccine, 60 kids survive, right? I mean, I think, again, if you walk down on the street and say, hey, excuse me, sir, if I gave 60 kids a perfect vaccine out of 160 would survive, I think most people say, well, yeah. But no, that's not true either. If that were true, you'd only see the yellow vaccinees at the end of the run. And lo and behold, here they run. And in the end, there's secondary protection. There are some blue kids who survive because they get secondary protection from the yellow kids. And this is herd immunity, all right? This is all very elementary, but they're insights that you get from even toy agent-based models. Even the toy agent-based model alerts you to these deep, important, fundamental phenomena in epidemiology. And they even do pretty well empirically when the setting is like a playground. So the toy model is on the left. The blue curve is the healthy kids. The red curve is the infected kids. And the blue curve falls as people transfer into the infected class. And that's exactly what happened in many, many data sets of this sort. Here's an influenza epidemic in the dead of winter in a British boys' boarding school where all the windows are shut and everybody's eating out of the same bowl or whatever they're doing. You get very good transmission and you get pretty good agreement. Okay? So that's just the flavor of agent-based models. More generally, an agent-based model is an artificial society of software people, agents, who interact directly with one another in space, in networks, in organizations, on landscapes, what have you. Agent-based models allow you to build populations of very diverse, heterogeneous agents. They can adapt to their conditions, and they can be cognitively plausible. They're not the canonical rational actor that you encounter in economics and game theory, which of course have their place. But in health and in behavior generally, there are well-documented departures from perfect rationality, and it's not hard to implement those in these software people, which we do. So to understand a macroscopic phenomenon like a spatial pattern, an unequal distribution of some sort, or epidemic dynamics, we grow them from the bottom up in agent-based models. And that's really what we mean when we say, what explains the macroscopic phenomenon? It's the micro world that generates it. And my word for this is generative social science and generative epidemiology and what have you. And agent-based modeling is the scientific instrument for generative social science. It's the principal scientific instrument for that. Okay. And when you grow them from the bottom up, they may also suggest bottom-up solutions, right? They may suggest interventions at the local level that change what emerges at the macro scale. So it's powerful from that point of view. Agent models can encompass a lot of complexity that is hard to capture with equations, or at least with equations that mere humans can understand. So let me give you some serious now grown-up examples of agent-based modeling and try to relate them to climate change or the drivers of climate change. All right, one issue that we talked about briefly is this northern drift of vector ranges. Not clear how important an effect this is for Zika, which is a different kind of mosquito, albopictus. But we did a model worried about Zika at the time. Bernadette headed this up with the Department of Health in New York City. And we built an agent-based New York City Zika model. In fact, we built an entire artificial New York City that can be used for all sorts of other problems, sexually transmitted diseases, who knows. Zika is very interesting because it has several transmission channels. One is vector-borne, from mosquito to human. Another is human-to-human sexual transmission, mother-to-child maternal transmission, and importations from outside the country. So we built this artificial New York to think about this. We included every census tract in New York, 7.5 million individual New Yorker agents, and several million mosquitoes. The sexual transmission we modeled, of course, crudely, because we don't know exactly how this works, but we have reasonable data from STDs and research on sexually transmitted disease to reconstruct plausible networks that we then vary, of course. If you can kill that, that'd be great. Okay, so there's sexual transmission. And there's mosquito to human transmission. We found the one guy in the New York Department of Health who knows every mosquito personally. He's a wonderful, wonderful scientist named Wahid Bajwa, who shared with us their trap data on where are the mosquitoes. So we were able to develop a detailed heat map of mosquito densities across New York. And we had reasonable data, again, plausible data on daily itineraries, people coming and going from work, people going to school, and so forth. So in your itinerary, you traverse parts of the city that may be high density mosquitoes and others that may be low with mosquitoes. So we could build a picture of contact with mosquitoes as people come and go and get a measure of transmission that way. And we implemented the whole thing in a wonderful language called NetLogo, which we teach, which is, again, very easy to learn. And found that an important risk is off-season asymptomatic sexual transmission. This is, again, in New York's a high latitude. This is not an immediate concern, but it's a concern in Florida, and it's a huge concern in Latin America and in the Southern Hemisphere. And the idea is that sexual transmission, I think many people would think, look, the mosquitoes are gone, thank God, we made it, it's November, there's no bugs. But there's still sexual transmission of infected blood. And if that continues, by the time the mosquitoes come back in the spring, there's an immense pool, no pun intended, of infected blood, and you can get a much bigger spring resurgence if you had winter sexual transmission than if you didn't. So it's important to maintain vigilance about sexual transmission even in the mosquito dormant season, which is not an intuitive finding, but one the model made quite plausible. And here are some runs of mosquito transmission and sexual transmission. Okay, so that's an insight for policy that's useful. Ebola. Here's another example where we did quite a bit of work. You may recall in September of 2014, the CDC published, very, very frightening projections about Ebola transmission in Liberia and Sierra Leone, and they projected that, it could be 1.4 million cases by January. I'm going to come back to this, but I disputed these pretty publicly, actually, and this is not how it turned out. I'll explain what we did. But to relate this to climate change, Ebola was not new, of course. We've known of the Congo Ebola since about 76, and there was a huge spike in 2014, and it's back now in Congo. But why was there a big spike in 2014? And particularly, why was it suddenly, urban? You could argue, or you might posit, that it was genetic variation, drift, recombination. There's no real evidence for that. More compelling and interesting for our purposes are changes in land use. Jonathan Epstein, no relation, or at least no immediate relation. Deforestation is a big driver of climate change, and it increases vector densities non-linearly. Right? If you have a forest that's 10 by 10, full of vectors, bats in this case, and you reduce it by 1 on each side. It's 10 by 10 to begin with. Now reduce it to 9 by 9. It actually reduces the area by 20%, right? It goes from 100 square to 81 square. And the probability, the host contact probability spikes accordingly. You're packing hosts into a smaller area. So when you go in there to do logging or build roads or other things related to urbanization, you have much more contact. And I think another field that has a role in all of this is remote sensing and geography is also an area where that could play productively with us. Here's some example of deforestation in this part of Africa. And over time, it's been very, very dramatic. All right? So host densities are increasing. People are moving into urban areas. Now, the CDC model ran really, really way too hot. I loaded this at Hopkins at the time. And the reason it ran so hot is that there's no behavioral adaptation. It's perfectly mixed. You put everyone in a bowl, and they mix with perfect, like they were in a chemical reaction, and it runs very, very hot and blows up. An agent-based modeler would say, wait a second, there's networks, there's space, and there's behavioral adaptation. people don't just keep mixing if there's a plague in their neighborhood. They do something differently. And agent models let you include behavior. And in the case of Ebola, this was really what made the difference. Changes in sanitation, hygiene, personal protective equipment, burial practices was a huge factor. Reduction in the stigma of people who had the disease, right? If you feel stigmatized, you don't go to the treatment center. That's a problem. Early diagnosis and a different rendering. And we published this in Nature, where I also published this critique of the CDC, saying, look, you're immune when you survive Ebola. Mobilize those survivors to deliver treatment, bring people to healthcare centers, change burial practices. They're trusted, they speak the language, they're not aliens in moon suits, and this is what made the difference. So the standard model says the thing is going to blow up, and I said, look, it's not going to blow up as much, and there's going to be endemic levels, and as people's complacency returns and so forth, there'll be cycles, and this is where we are in Congo. There's a big outbreak now. So behavioral considerations can inform the design of interventions. And Erez Hatna, who couldn't be here, is building at our lab a complete computational reconstruction of the Ebola epidemic in West Africa. This is an early version. I won't delay you with the color code. But again, we can reconstruct these things computationally and then ask what changes may matter. Another climate-related dynamic is urbanization itself. Urbanization increases risks by it increases population densities and promotes disease transmission, of course. But it also increases vulnerability to environmental shocks. And I think an important area is the synthesis of agent-based models and environmental modeling. And we have a new certificate program headed by Robin Gershon that will include this sort of work. But here's an example of work we published that combines atmospheric physics modeling, computational fluid dynamics, and agent-based computational modeling to look at evacuations. So here's an artificial Los Angeles, a three-dimensional Los Angeles. There's going to be a toxic plume released over here. This could be man-made. It could be naturally occurring. It could be accidental. And traffic is color-coded for velocity. And these buildings are full of agents. It's a completely realistic artificial Los Angeles. And if people simply pour out into the street, they produce massive congestion and increase their exposure to the thing. So everybody run for your life is not a good strategy. But not all buildings are impermeable, so shelter in place is not also a perfect strategy. So the trick is to find an optimal mix that confers resilience on a city in this sort of circumstance. Here's some other views of it. Upper left is what you saw. Upper right is looking down on this plume as it spreads. Lower left is another view. And of course, the metric of interest is how many people are exposed and how many people die. All right, how many agents? Parts per million per second is the measure of toxic exposure, and we can track that. So we try a different strategy, we get a different result. We try lots of different strategies, and we find the one that works best. Okay? So one initiative at my lab here, I think is a distinctive thing for NYU, is to build models of this sort. We're getting into an era of megacities, and we've built Los Angeles, we're doing Lower Manhattan, we have Washington, D.C., and build petabyte playbooks for the global megacities and think about urban disaster resilience in the post-evacuation age. There's no way to evacuate these places, at least not everybody evacuate. So there's lots of interesting work, and I think you really can't think about this without models of some sort. I mean, you can't just sit around a table and sort of have wise people, opine on the best way to handle a toxic release in Los Angeles. Or a global pandemic. We have the Planetary scale agent-based pandemic model. Again, this is a very, I think, a distinctive activity here. And we did this for H1N1 for NIH as part of a big network called the MIDAS network, Models of Infectious Disease Agent Study. And here we were asked a very direct question. I'll show you the model first and then tell you the question. So black if you're healthy, red if you're sick, blue if you've had the disease, whether you recovered or not. We just wanted incidence, and then you could apply your own case fatality rate, which wasn't well known anyhow. So here is a run starting in Asia. Red is sick, and it's got global transportation and land transit and lots of things. There's a lot of uncertainty, of course, about contact patterns in the southern hemisphere, things like this. But new data sources, big data, Twitter data, geolocated data, this is helping a lot understand how people really do bump into one another. So the question was this. Here's the policy question. Suppose a novel pandemic strain emerges in Asia. We have no vaccine. We have a finite stockpile of antiviral drugs. Modelers, do you, A, send all the stockpile to Asia to crush the thing at its source, or do you withhold the stockpile for your Americans in the event that it goes global and give us your answer tomorrow? Right? That's a really clear question. Can't get at it without models. The answer, if you detect the thing's emergence, that is, if it emerges as a new species, if you can detect that within 21 days of its emergence, then stockpile, send the stockpile makes sense. Otherwise, probably not. Obviously, a real problem is surveillance. I mean, we don't know when these things emerge exactly. And I think the surveillance systems in most of the countries affected by these diseases are very weak. So that's an important thing to shore up. The pandemic, just to talk about a global threat, the pandemic threat. I mean, 1918 pandemic killed 50 million people. Most people today that I've encountered think that's just implausible. You know, I've been in rooms with lots of doctors and scientists, and people say, oh, get real. We're never going to see anything half that bad. And I'll say, okay, fine. What about a pandemic that's 1/100th that bad? That's still 500,000 deaths in one flu season. That's horrific, and it merits serious attention, and modeling is the only really serious way to think about that. So I think there's a role for modeling this kind of low probability but very, very high risk event. Another application of the global model was to look at where could Ebola go from West Africa. And Ebola has a 21-day incubation period, so there's lots of time to travel around before you're symptomatic, and you could land all over the place. Again, these are just random runs. I'm not putting a lot of money on these, but they did show that you could get it in America, you could get it in Madrid, which actually, oddly enough, it did happen, and elsewhere where it didn't. But the point is, you can use these models to think about travel restrictions and other non-pharmaceutical interventions for these global health threats. Okay, so in conclusion, I would say agent-based modeling is a very vibrant field spanning myriad threats and scales. My Santa Fe Institute friend and Nobel laureate Murray Gell-Mann once said that agent-based models were prostheses for the imagination. So at the very least, we can use them to think synthetically and systematically about complex global challenges that we're facing, and hopefully they can help us think creatively about prevention and response. Thank you.